Fever is one of the most common symptoms for which parents bring their child to the hospital or casualty. Today I am going to discuss about fever and the most common medicines and the first aid which you can use in fever in children. I am Dr. Milind Jambagi, a pediatrician and pediatric ICU specialist at Pune. Don't miss the end of this video to know the most important tip. Fever is the most common symptom which can happen due to many viral bacterial infections or any of the inflammations in children. But what is fever? Body temperature above 99.6 degree Fahrenheit or 37.5 degree centigrade is called fever. Whenever your child gets fever, do not panic, because fever is just an indication that your body is trying to fight or react to something like an infection or inflammation in the child. And what you could do at home till you are waiting to see the pediatrician, if you have any of these medicines at home, you could give them. I would recommend keeping one of these medicines in your child's medical kit. I would tell you the dose of that medicine at the end. The first aid which you can do at home is check the temperature, and after you confirm that the temperature is above 99.6 degree Fahrenheit, which is fever, you can give paracetamol to your child, which is the safest medicine to be given in any child for fever. What is the dose of the paracetamol to be given? So if you see, there are multiple medicines in the market available. That is causing a lot of confusion among the parents, and that is the most common reason why parents come to the hospital, because they don't know the dose and they don't know the medicine to be given. And despite knowing the dose, parents get panic because it's the child and they don't want to take a chance, which is understood. Let's first understand what is the difference between all these medicines. So there are some formulations of paracetamol which come as drops. So we need to understand that drops are always the most concentrated formulation of paracetamol. So these are paracetamol drops which contain 100 mg of paracetamol in 1 ml of the drug. So if you see, 1 ml of this drug contains 100 milligram of paracetamol, which is quite concentrated and strong. This is usually used in children less than 10 kilos or infants roughly. There are other formulations like paracetamol 120 or 125 mg in 5 ml, which are syrups. Or you could also get as paracetamol 240 mg to 250 mg in 5 ml, which are again the syrups, and paracetamol 500 mg in 5 ml syrup. So this paracetamol is usually prescribed in children about 10 years of age. So you have paracetamol which comes as drops, you have paracetamol which comes as 5 ml 120 or 125 mg, you have paracetamol which comes as 5 ml 240 or 250 mg, and you have paracetamol which comes as 5 ml 500 mg. You might have understood that paracetamol drops are the most concentrated because they contain 100 mg of paracetamol in just 1 ml of the formulation. So these medicines have to be given very cautiously in children because they are very concentrated. If I have to tell one formulation out of this to be kept in your child's medication kit for fever as a first aid, it would be paracetamol 120 or 125 mg, which would be something like this. And the rough dosage for the first aid at home for one dose you could use as, just remember, half of the weight. Let's say your child's weight is 10 kilos, divided by 2, that is 5. So you could give roughly 5 ml of paracetamol 120 mg to your child. This is the safest one to be given as a first aid till you visit the pediatrician.